Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Listeria Infections. Introduction. An infection caused by listeria is called listeriosis. Listeria infections are a type of food-borne illness. They are caused by Listeria monocytogenes, bacteria found in soil and water. Symptoms of a listeria infection can be severe enough to put a healthy person in a healthcare facility. For people with weakened immune systems, it can be fatal. This program explains the symptoms, causes, diagnosis, and treatment of listeria infections. Listeria infections. Listeria infections are caused by the Listeria bacteria. These bacteria are found in soil and water. Listeria can be found in a variety of raw foods. It can also be found in processed foods and foods made from unpasteurized milk. Most people get a listeria infection by eating food contaminated with the bacteria. Unlike many other germs, listeria can grow even in the cold temperature of the refrigerator. After entering the body, Listeria bacteria infect the tissue covering the small and large intestines. Most people diagnosed with a listeria infection have an invasive infection. This means the bacteria move beyond the gastrointestinal tract. Anyone can get the illness, but it mostly affects adults with weakened immune systems, newborns, older adults, pregnant women. For these people, a severe listeria infection can cause death. It is important to follow recommendations for safe food preparation, consumption, and storage. This may reduce the risk of listeria infections. Symptoms. Listeria infections may cause diarrhea, fever, muscle aches, nausea. Symptoms may begin as early as a few days after eating food contaminated with the bacteria. It may take as long as 2 months before the first signs of infection begin. If the infection is invasive and listeria spreads to the nervous system, symptoms may include confusion or changes in alertness, convulsions, headache, loss of balance, stiff neck. Pregnant women typically experience only a mild flu-like illness, but infections during pregnancy can lead to miscarriage, stillbirth, premature delivery, or life-threatening infection of the newborn. In newborns, symptoms of a listeria infection may include fever, irritability, little interest in feeding, vomiting. Bacterial meningitis is a life-threatening complication of a listeria infection. It can cause high fever, severe headache, stiff neck, confusion, or sensitivity to light. People experiencing these symptoms should seek emergency care. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Listeria infections are caused by eating food contaminated with Listeria bacteria. Babies can be born with a listeria infection if their mothers ate contaminated food during pregnancy. Listeria bacteria are often found in soil and water. If an animal eats or drinks from a contaminated source, it may become infected. Animals can be infected but not show symptoms. If meats or dairy products are taken from infected animals, the products may be contaminated with the Listeria bacteria. A person could become infected by consuming these foods. When Listeria bacteria get into a food processing factory, they can live there for years and contaminate food products. Unpasteurized milk and cheeses, as well as other foods made from unpasteurized milk, carry the largest risk for Listeria contamination. Listeria is killed by pasteurization and cooking. However, certain ready-to-eat foods can also be contaminated after cooking or processing, such as processed meats, such as hot dogs and deli meats, smoked seafood, soft cheeses. Unlike most bacteria, Listeria can grow and multiply in some foods in the refrigerator. Listeria bacteria have also been found in a variety of raw foods, such as uncooked meats and vegetables. Diagnosis. Diagnosis often begins with your healthcare provider asking you about your symptoms and medical history. Your healthcare provider will also perform a physical exam. This helps rule out other possible causes of your symptoms. The best way to confirm a Listeria infection is a blood or spinal fluid test. These tests may be used to look for the bacteria. Treatment. Treatment for Listeria infections depends on the severity of symptoms. Most people with mild symptoms will not need treatment. The infection will clear up on its own. People with more serious infections can be treated with antibiotic medicines. Antibiotics are powerful drugs used to fight bacterial infections. When taking antibiotics, it is important to take them exactly as prescribed. You should take the full amount, even if your symptoms get better. Stopping antibiotics too soon can cause the infection to return. It could make the infection more difficult to treat. When taken promptly during pregnancy, antibiotic treatment may help prevent the infection from affecting the baby. When newborns are diagnosed with a Listeria infection, they may receive a combination of antibiotics. Prevention. The best way to prevent a Listeria infection is by properly washing and handling food. Here are some tips. Rinse raw produce, such as fruits and vegetables, thoroughly under running tap water before eating, cutting, or cooking. Even if the produce will be peeled, it should still be washed first. Scrub firm produce such as melons and cucumbers with a clean produce brush. Dry the produce with a clean cloth or paper towel. Separate uncooked meats and poultry from vegetables, cooked foods, and ready-to-eat foods. You can also help prevent Listeria infections by keeping your kitchen environment cleaner and safer. Try the following. Wash hands, knives, countertops, and cutting boards after handling and preparing uncooked foods. Listeria bacteria can grow in foods in the refrigerator. Use a refrigerator thermometer to check the temperature inside your refrigerator. The refrigerator should be 40 degrees Fahrenheit or lower, and the freezer 0 degrees Fahrenheit or lower. Clean up all spills in your refrigerator right away, especially juices from hot dog and lunch meat packages, raw meat, and raw poultry. Clean the inside walls and shelves of your refrigerator with hot water and liquid soap, then rinse. Cooking meat and poultry thoroughly is another way to prevent Listeria infections. You should thoroughly cook raw food from animal sources such as beef, pork, or poultry to a safe internal temperature. It is also important to store your foods properly. The following tips may help prevent infection with Listeria. Eat pre-cooked or ready-to-eat food as soon as you can. Do not store the product in the refrigerator beyond the use-by date. Store opened packages of hot dogs no longer than 1 week and unopened packages no longer than 2 weeks in the refrigerator. Store factory-sealed, unopened packages of luncheon and deli meats no longer than 2 weeks. Store opened packages and meat sliced at a local deli no longer than 3 to 5 days in the refrigerator. Divide leftovers into shallow containers to promote quick, even cooling. Cover with airtight lids or enclose in plastic wrap or aluminum foil. Use leftovers within 3 to 4 days. You should also choose safe foods. For example, do not drink unpasteurized milk or eat foods that have unpasteurized milk in them. Recommendations for people at higher risk, such as pregnant women, people with weakened immune systems, and older adults also include not eating hot dogs, luncheon meats, cold cuts, other deli meats, or fermented or dry sausages unless heated to an internal temperature of 165 degrees Fahrenheit. Avoid getting fluid from hot dog and lunch meat packages on other foods, utensils, and food preparation surfaces. Wash your hands after handling hot dogs, luncheon meats, and deli meats. Paying attention to labels. Do not eat refrigerated pâté or meat spreads from a deli or meat counter or from the refrigerated section of a store. Not eating soft cheese unless it is labeled as made with pasteurized milk. Make sure the label says made with pasteurized milk. Examples of soft cheese include feta, queso blanco, queso fresco, brie, camembert, blue-veined, or panela. Not eating refrigerated smoked seafood unless it is contained in a cooked dish, such as a casserole, or unless it is a canned or is a shelf-stable product. These are often labeled as Nova-style, lox, kippered, smoked, or jerky. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A listeria infection is usually caused by eating food contaminated with the listeria bacteria. It mainly affects older adults, pregnant women, newborns, and adults with weakened immune systems. Rarely, persons without these risk factors can also be affected. It is important to follow recommendations for safe food preparation, consumption, and storage. This may reduce the risk of listeria infections. Treatment for listeria infections depends on the severity of symptoms. Most people with mild symptoms will not need treatment. People with more serious infections can be treated with antibiotic medicines. Thank you for using Explain.